Millions of Americans suffer from back pain, and for many, the cause remains a mystery. On today's show, we will explore the hidden causes of back pain and offer you tips on how to best manage and treat back pain. And as always, we're here to answer your questions. That and more coming up on this episode of Ask the Doc, No Appointments Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hello and welcome to Ask the Doc, No Appointments Needed, the show where the health questions you send in are answered by our doctors and medical professionals. I'm Dr. Georgiy Brusovanik, a board-certified minimally invasive spine surgeon, and thank you for joining us today. Not every patient with back pain fits into a neat box. Sometimes the true source of pain is overlooked. The misdiagnosis or a missed diagnosis, which has been a story for so many patients who come to see me. Let's get right to your questions. Our first question comes from Arthur, who emailed us asking about lower back pain. And he writes, "Hi, Dr. B. Since childhood, MRI after MRI has come back normal, but I'm in a lot of pain, and I know something is wrong. What else can I do?" Arthur, this is a very common problem, and I definitely have some interesting insights for you or someone else or anyone else really who's been suffering since childhood. In the meantime, I want you to see a video about the most common sources of spine-related myths. Take a look. I love this video because it really highlights some of the more common myths. You are allowed to slouch. Your posture comes from your skeleton, so it's impossible for you to affect your posture. You can carry heavy loads, and you don't need to stay in bed whenever you have minimal back pain. So this is really, really helpful. But getting back to Arthur, Arthur mentioned that he had MRIs since he was young, since he was a child. That tells me that there was a reason why he had to have all these MRIs. Now, look, a standard MRI is a way to look at the insides of the human body, but there are projections, meaning different views. We take the human body and we cut it like a loaf of bread, or we take sagittal projections, midline, and then scroll outwards, or we take coronal projections and then scroll backwards and forwards. All these planes are at 90-degree angles to each other, but our spine isn't like that. So there are parts of a human skeleton that don't necessarily get imaged sufficiently with a common MRI. So someone who comes to my office and says, I've had back pain since I was young, since I was a teenager, most of the time, the problem is congenital. And specifically, 90% of these patients have what's called spondylolysis and possibly spondylolisthesis. These are common terms in my world, but really what they mean is simply failure or formation of a little bridge of bone that doesn't always fall within the neat projections of the MRI. So it's common for that to be missed. When a patient comes to me and says, I'm in pain, I believe that patient. And just because the MRIs were negative doesn't mean that my search for their diagnosis or the underlying cause of their pain is over. The answer is to scrutinize the MRI further. And oftentimes, reading the report isn't enough. Arthur, make sure that whoever looks at your back, whoever looks at your MRI actually opens the images and looks at them themselves. Now look, there's an additional study that you can have, and that's a CAT scan. If you have what I think you have, a CAT scan will really show it much better than an MRI. So don't be hesitant to ask your doc for that study, or just message me and I'll send you a prescription. Arthur, I hope that helps. The next question comes from Miguel, who emailed us and asks, I've had numbness on the top of my foot and was told it was diabetic neuropathy. My diabetes is mild, so that doesn't make sense. I've had some back pain, but my doctor didn't think that had anything to do with it. Any thoughts on what it could be? Miguel, one of the most common misdiagnoses or mistaken diagnosis that I see in my office are patients who have nerve pain that gets mistaken for peripheral nerve pain or neuropathy. In other words, they have sciatica type pain emanating from their back, and they get labeled as having peripheral neuropathy or something, as you mentioned, that should be related to severe diabetes. And exactly as you said, it doesn't make sense with well-controlled or early diabetes. So this is a very common error. I'd say 95% of patients who come to me with the diagnosis of neuropathy don't actually have neuropathy. And look, if you have that diagnosis, you're kind of doomed. The treatments are not that great. But if it's a spine-related pain or radiculopathy, as it probably is in you, Miguel, then it's definitely treatable, and then you don't have to live with that pain or that numbness. So if your doc is refusing to think further than just the diagnosis of neuropathy, then I recommend that you find a second opinion and request an MRI of your lumbar spine. That's a great question, Miguel. I'm sure it's relevant to so many of our viewers. Thank you. Our next question comes to us from Vince, who emailed and asks, I could barely walk due to leg pain, but when I would sit up, I would feel fine with only minimal back pain. One doctor even accused me of faking it. It's very frustrating. What could it be? Vince, that's another common error that I see amongst patients who come to my office. You know, there are really no outward sign of back disease. And if you have what's called stenosis or narrowing in the spinal canal, you may have symptoms that are purely neurological, meaning that when you stand up and try to walk, your legs just stop working. And that doesn't necessarily have to be the only thing that stops you. With stenosis, a good number of patients get up, try to walk, and then they have to stop because of back pain. Some will say their legs feel woody or tired. Bottom line is they just can't walk. But when they sit, they have no symptoms. And as you mentioned, when you find that comfortable position on the chair, you can sit there for a while. That's the most typical finding in patients who have stenosis. So don't let your doctor's accusations dissuade you from continuing on to your journey to obtain a diagnosis. You need to know what is the underlying cause to your suffering. And I promise you that there is going to be an underlying cause. No one wants to be in pain. Your symptoms, Vince, sound like stenosis. So an MRI of your lumbar spine would definitely elucidate that. I hope you can get that from your doc, or I'm happy to send you a script. I hope that helps. All right, some great questions so far, but we still have time to answer your questions. And it's so easy to send them in. Here's how.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Let's keep it going. Our next question comes in from Steven, and he writes, I'm glad I found your show today. I've had severe pain off to the sides of my back. I'm assuming it's muscular, but it's not getting any better. Any thoughts of what it could be? Stephen, when patients tell me about pain off to the sides, it's one of two things. Either it's a muscular spasm or something spinal related, or it's your kidneys. So if you've had a history of kidney stones, if you feel the pain really is very severe and it's truly in your mid-back, then kidney stones have to be a consideration. A lot of men will say that it's the worst pain that they have ever had. And if you're suffering with that kind of pain, I would go to an urgent care center and see if an ultrasound of your kidneys would elucidate the answer or a diagnosis. You need a diagnosis. You need to know where this pain is coming from. I hope this helps. Susie followed up with her email, and she writes, is it normal for back pain to mask something more serious? My friend went to a doctor with severe back pain and wound up in the hospital. I feel like something had to be missed. Susie, that's a great question. And there are very important mimickers of back pain or things that cause back pain but aren't spine related. Again, going back to the common theme of if you have back pain, then you need a diagnosis. As in, you need to know exactly what's causing that back pain. So someone who ends up in the hospital with severe back pain could have a problem with their colon, which is a structure in your digestive tract that is very deep inside and may produce back pain. There could be issues with an aneurysm of the big blood vessel called the aorta. Again, life-threatening problem that can present with back pain. And then, as mentioned earlier with Vince, it could be kidney stones. So all these issues deserve to be elucidated, and you as a patient deserve a diagnosis. You deserve to know where the pain is coming from. All right, let's continue on with Carrie's question, and she writes, my husband has been suffering from severe buttocks and back pain, but he also has pain in his groin. I'm getting very concerned. Are those usually related? Okay, that's a great question, Carrie. So groin pain per se could be spine, but could be the hip joint. And that same hip joint can cause buttock pain and even back pain, although that's less common. So if your husband has a difficult time walking, and as he walks, the pain in his groin gets worse, then I would recommend obtaining both a lumbar spine MRI to look for spine-related causes, but also to obtain imaging of his hip joint. And you may find that the cause is very specific to that joint, in which case correcting that joint, either with therapy or injection, or maybe even with a joint replacement, should erase that pain. Now, before you run into surgery, make sure you confirm the diagnosis, and that means seeing a doc who specializes with the hips, somebody who will examine you, ask you all the right questions, who will then give you the certainty that indeed you have the right diagnosis. You indeed know where the pain is coming from. We just got a question from Jenna, this time from our Facebook page, and she writes, I need your help, Dr. B. I have been in constant pain and can't sit for too long. My doctor treats me for hemorrhoids, but nothing changed and the pain has remained constant. Can it actually be from my back? What do you recommend? Jenna, you belong in the top 1% of the medical school class, because most docs do not know that perianal, sacral, coccygeal, or otherwise buttock pain can be referred from the back. So you are right on. I see so many patients who come into my office after having horrible, unethical, and ineffective procedures like intraanal coccyx manipulations for problems that have nothing to do with the coccyx, the problems that simply refer pain to that region, but problems that come from your back. Specifically, it's the bottom disc, L5S1. So often, I see patients who have minimal back pain, MRI evidence of L5S1 disc degeneration, and then pain around their anus, their buttocks, or their coccyx. So, if the treatment for your hemorrhoids did not work, ask your doctor to obtain a lumbar spine MRI. And I'm really proud of you for speaking out, Jenna, because so many patients continue to suffer in silence after a few of these terrible, ineffective treatments. Proud of you. All right, we still have time to answer your questions, and it's easy to send them in. Here's what you need to do.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. Our next question is from Maria, who checks in on Instagram, and she asks, I'm so frustrated. I've had years of back pain, not constant, but often. Every doctor I went to said the MRI was good, but nothing changed and the pain continued. What else can I do? All right, that's a really good question, Maria. So there are a couple of things that an MRI may not show or may not get noticed by the radiologist or your treating doctor after looking at the MRI. Specifically, we mentioned earlier, if your pain has been there forever, you have to look for what's called a pars defect or spondylolysis. And if it's not there, but the symptoms fit and you've had pain forever, you deserve a CAT scan. Another finding that is very frustrating to patients, and specifically, as in your case, causes intermittent pain, is what's called an annular fissure. Discs degenerate in a pretty predictable manner. The outer layers of the disc become permeable and develop these fissures or cracks called annular fissures. These fissures allow some of the disc content to sneak out and cause local spasms and even sciatica. But they may be totally missed on an MRI, or they just may be described as a degenerative disc, belittling sort of its significance. Now, if you've been suffering on off for years and it's it's not constant, it's a very good chance that that's exactly what the problem is. So your doctor needs to hear exactly where the pain is when you have it, and then he or she may be able to piece together exactly which disc is emanating this pain or which disc is causing that irritation. Then an epidural steroid injection may just cure you. So be optimistic. Don't lose hope. Get at the diagnosis or the underlying cause of your pain. And you may find that all these years of pain were for nothing. You may find that you can go right back to normal life, which I really hope for you. All right, next case is from Roman, who reached out to us on Instagram, and he writes, my neighbor had back pain along with some abdominal discomfort and started losing weight. The first scans didn't reveal anything. Now they are talking about taking me to do more scans. Does it sound like back issues? I'm afraid it could be more serious. So I'm really glad you reached out, Roman. Losing weight without wanting to lose weight is a red flag. And it's very important that you get a true diagnosis, that you find out why you are losing weight. Now, if a patient comes to me with a history of back pain and losing weight without wanting to lose weight, I usually obtain what's called a PET scan. It's a very significant study that looks for unusually high calorie uptake within your body, so that if there is a cancer of some sort that's causing this weight loss, a PET scan should be able to pick it up. I think it's very important that you talk to your doctor, and anyone out there, to all our viewers, if you feel like you are losing weight without trying to lose weight, you definitely should not wait. You should definitely go see a doc, explain all of your symptoms. You may find your doctor ordering other studies like blood work, a CAT scan of your chest, abdomen, and pelvis. Now, these studies may sound excessive, but that is indeed how we as doctors look for scary things like cancer. So, Roman, I'm really glad that you reached out, and I really hope that you don't let this linger. You jump on this right away. The next question is from Nick. Nick reached out to us via YouTube, and he asks, here's an interesting one for you, Dr. B. I've had back pain and have had several MRIs. Everything shows up normal, but it still hurts. What could it be? Nick, I have a lot of questions for you because, as the theme of this show dictates, we're looking for the unusual. Now, back pain that is not related to disc degeneration can occur. Now, the questions that your doctor should be asking you include, is there additional weight loss? Do you have changes in your bowel function, as in, do you have constant diarrhea or do you find blood in your stool? Your doctor will need to examine you. And by examining your belly, he may feel for a pulse. That may seem strange, but if there is a dilation or growth of your abdominal aorta, the most important blood vessel that carries blood from your heart to your extremities, then a pulse in your abdomen may indicate a very scary sign, something that deserves urgent attention, known as an abdominal aortic aneurysm. Now, there's still other causes of back pain that are not related to your spine. There are also causes that are spine-related, but that are often missed. Annular fissures, as in something we just brought up earlier with the previous question, is a sign of disc degeneration that can cause back pain, but does not readily show up on a common MRI. And finally, structural issues like what's called a pars defect, which would really require your doctor to scrutinize the MRI to make sure that it was not missed by the radiologist. Nick, in any case, and this pertains to anyone who is in the same boat, someone who's been suffering for years and who does not have a clear diagnosis, do not quit. You have one body. And it's very important that you get to the bottom of your pain. You find out exactly where it's coming from. That's what I mean when I say you need a diagnosis. What that means is that you need to find a doctor who will reliably tell you what is the cause of your pain. Once you have that, once you know where the pain is coming from, then you can predictably find solutions that relate to the problem, and you can predictably get better, as opposed to trying this or trying that for years and then finding yourself in the end suffering from the same problem as before. All right, let's go on to the next question. This one is from Lawrence. My back pain has gotten worse lately, but after watching the show today, I'm now wondering if it is in my back or something else. How do I suggest that to my doctor? Well, just like that, Lawrence, be open with your doctors. Give them all the information that may possibly help them, and more so, tell them things that you don't think are related, but they may. So, for example, unwanted weight loss is something very significant to bring up. The duration of your pain, whether your pain is correlatable to certain activities like standing, sitting, or laying down, and whether you have pain going down to your legs. Now, you may come into your doctor saying, I have neuropathy. Tell your doctor that you've been told that you have neuropathy. Because if it's not neuropathy, give your doctor that opportunity to figure out exactly where it's coming from. I really appreciate this question, Lawrence. Our next one is from Sherry. Sherry emailed in, and she has concerns. She writes, my doctor told me I need to have a spinal fusion. And he said, don't worry, it's fairly common. It sounds serious. What exactly is it, and is it safe? Sherry, I disagree with your doctor. It is common, but that does not erase the seriousness of this procedure, because you can't undo a fusion. Now, if you have deformity and that's causing your pain, then it's reasonable to consider a fusion because it will cure you. But if you have a degenerative disc that's causing your pain, then you may be a candidate for something that preserves your motion, or a disc replacement surgery. So from that point of view, it will be very important that you go back to your doc or get a second opinion with somebody who takes fusion surgery more seriously as you do. Because remember, fusion surgery comes with some serious baggage. If it's performed in a classic way, which is how it's done most of the time, then you have a 36% chance of having to go back for more surgery. If your fusion fails, you need to know about the different modes of failure. Please don't stop asking questions. And if your doc is not responding, then that's a good enough reason to seek a second opinion. Back pain isn't always what it seems. As you've just heard, the root cause can be spinal, vascular, it can be hip, kidney, or even cancer or autoimmune disease. If you're struggling with pain and not getting answers, don't stop asking questions. Get a second opinion. Find someone who cares enough to really look. I am Georgiy Brusovanik, and thank you for tuning in to Ask the Doc. No appointments needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.